Hello everybody. So today I've come back with another video and I hope that my previous videos have been of some help to someone somewhere. And today my topic is melasma or chaya in common language. I see many cases of melasma every single day, and a major chunk of patients in all skin clinics are chaya, especially in the hills. This is because, like I said in my previous video, because of our close proximity to the sun. And chaya presents as chaya or melasma presents as dark patches, on our face especially, and they can also occur in other parts of the body, but majorly you'll see them on the face. And they are caused due to an increase in the pigment that gives color to our skin. This pigment is called melanin, and melanin is produced by cells called melanocytes, which are present in the skin. So in my previous video, if you remember, I told you that melanin is also responsible for protection against UV rays. But UV rays, on the other hand, can cause an increase in the production of melanin, leading to formation of melasma or chaya. So generally we see chaya or melasma more in fair skinned people than in dark skinned people, for obvious reasons, because the dark skinned people have more melanin to protect themselves from the sunlight. And then we see chaya or melasma more in females than in males. And you must have seen chaya or melasma also occurs in pregnancy, especially in the second trimester of pregnancy. And like I said, it is due to increased production of melanin, and there are certain factors that can cause melanocytes to produce more melanin. And among them, the first and foremost and the most important cause is UV rays, the sunlight, can cause increased melanin production and cause formation of melasma. Then there are hormonal causes also, like for example, if you're taking hormonal therapy for some reason, or if you're taking oral contraceptive pills, these also can cause melasma. Of course, pregnancy, because of the change in hormones, your melasma can be produced. And then some certain drugs, when taken over a long period of time, can also cause hyperpigmentation and cause melasma. Now, as far as treatment of melasma goes, when patients come, the patients are so desperate to get rid of the melasma, they'll listen to anyone, suggesting a cure. They go for home remedies, then they'll try many sorts of treatment. They'll go to the pharmacies and buy drugs over the counter and use them, and then use them inadvertently without knowing how they work and without knowing the side effects, and then they'll end up with so much side effects from the medication itself. So most of what these over the counter medications contain are steroids, and steroids in combination with other agents actually do help in melasma. They do help in reducing melanin, in fact quite well. But we know that steroids have a lot of side effects, so they have to be used under supervision. You must know how much to use, for how long to use, and what way to use. So generally nowadays, because of side effects, steroids are not usually used for treatment of melasma. So try to avoid using medications over the counter and listening to people coming up with various solutions for melasma. You have to visit a doctor, you have to visit an expert, and then follow whatever the doctor tells you. Use the medications orally or topical application, and use the sunscreen the doctor has prescribed, because they know which sunscreens work and which don't. So this is important. But a major role that in the treatment of melasma has to be played by you, because you should be able, during that period of treatment, should be able to have proper sun protection. Because if you're going to just take medications, apply medications, and use the sunscreen randomly for as the doctor has prescribed, and not protect yourself properly from UV rays, your treatment of melasma will not be effective at all. Because UV rays sunlight plays a a very, very big role in the disappearance or in the appearance of your melasma. So I always say, if you're not using a proper sunscreen, if you're using just any random sunscreen, that won't work. If you are just taking medications, following the doctor's instructions, expecting it to work some sort of magic, and then if you are expecting a miraculous recovery in a short period, you're going to be very disappointed. Because while you are undergoing treatment, to make sure that the treatment will work, you have to practice very, very good sun protection. I always say, when my patients, any patient comes to me, the most important thing to do to get rid of melasma is to protect yourself against the sun. Use a good sunscreen. Use the sunscreen the doctor has provided. Use it as the doctor has instructed you to. and go up for regular follow-ups. And then nowadays there are certain treatments, like there are lasers, and then there are microdermabrasion, chemical peels. All these treatments have come up, and to some extent they are useful also. But some people, they have a wrong concept. They think that these laser etc. will cause permanent cure, that you never get melasma again, but it's not true. Nothing will, nothing can give you the guarantee that it will not reappear again. So whether it be topical application, or oral medication, or lasers, or whatever. And none of these treatments, be it lasers or be it chemical peels or medication, nothing will work if you do not protect yourself against sunlight during your treatment. Very, very important. So I always say, when I try to explain to the patient, I say, suppose there's a fire burning and you want to put out that fire, so you're putting lots of water on the fire. But at the same time, if somebody else from the other side is putting kerosene into the fire, the fire won't go away. The fire will keep on burning and keep on reappearing. Similarly, in melasma, if you only do treatment and keep on applying creams and taking medication and not protect yourself against sunlight, the sunlight will keep on creating more and more melanin, will help to create more and more melanin, and here you are trying to protect yourself, so your treatment will not be effective at all. So like I said, sun protection is really, really important. For example, suppose I were a patient of melasma. If I had melasma on my face, considering that I know I've treated so many patients over so many years, and then I know what increases melasma, what causes melasma, what helps in melasma. If I were a patient, what I would do first and foremost is always carry a scarf in my bag, carry an umbrella, carry a sunscreen in my bag. And if there's lots of sunlight, if I have to go out in sunlight and it's very harsh, the sunlight, I'll take out my scarf and cover up myself properly, and then carry my umbrella, and then reapply my sunscreen again and again. I'll go all out to make sure that the UV rays do not hamper my treatment or reproduce pigment while I'm undergoing treatment. So at least for a period of 3-4 months, you have to do this, obsessively go for sun protection. And after that, of course, it has to continue. But for your treatment, during your treatment phase, for the treatment to work, that is really, really important. So sun protection, like I said, in the form of umbrellas, in the form of hats, in the ladies' scarves, it's very easy to just put a scarf over your face, and the sunscreens properly and in the proper amount, and with in proper frequency, and with a good sunscreen, having all the criteria that a good sunscreen requires. So for melasma, like I said, sunlight, UV rays, UV rays, UV rays. The more you protect yourself against UV rays, the more the chance of your getting rid of melasma. Of course, superficial melasma, epidermal melasma is much easier to treat with that much effort and medication. By 2-3 months, you'll see a remarkable difference. But if your melasma is deeper, if you have dermal melasma, then it takes a longer period. Your melasma will continue for a longer period, and you may see certain lightening, but it tends to recover. It tends to come back faster, and it's a little more difficult to treat. So I think this is all for melasma, and I hope this video will help anyone with this problem. Thank you.